Hello, I am Dr. Pawan Poddar, consultant cardiologist at Yashoda Hospital, Malakpet. Today I will be talking about how to prevent coronary artery disease. We all know that coronary artery disease is nothing but deposition of cholesterol plaques in the heart vessels, and it can ultimately lead to heart attack. A lot of people in India die because of heart attack. So preventing coronary artery disease will go a long way in preventing all these deaths. So to prevent coronary artery disease, we should know what causes coronary artery disease. So coronary artery disease, we have lot of risk factors which can lead to coronary artery disease. The most important among these risk factors is hypertension. Hypertension is nothing but raised blood pressure. So if we have raised blood pressure, or if we are taking medicines for blood pressure, we are at a higher risk of developing coronary artery disease. So coronary artery disease can be prevented if we keep our blood pressure under control. We need to follow up with our physician from time to time. We have to take our blood pressure medicines regularly. We have to reduce the salt intake in our diet. That also goes a long way in decreasing the blood pressure. Another important aspect of controlling blood pressure is to go for regular physical activity such as brisk walking. People who are interested in swimming, they can go for swimming. People can do bicycling. Some people who are interested in some form of dance such as Zumba and all, they can do that. So this also helps in bringing down the blood pressure. Another thing, important aspect of control of hypertension or blood pressure is self-monitoring of blood pressure at home. Nowadays, lot of electronic BP apparatus are available, which are very easy to use and which are very user-friendly. So this BP apparatus, we can have one at home and we can check our blood pressure at home. So if the blood pressure is not under control, then we can visit our doctors. The levels of blood pressure for most people, if it is below 140/90, then it is considered as good control. For patients who have diabetes, the cutoff values are a little bit lower. It is 130/80. And similarly, patients who have kidney disease also, there is a lower cutoff which is set for those patients. So we should be aware of these numbers. If our blood pressure is higher than these numbers on multiple occasions, then we should go visit our doctor and get our blood pressure medicines adjusted so that the blood pressure is under control. The second most important risk factor for development of coronary artery disease is diabetes. People who have diabetes, they have 3 times higher risk of developing coronary artery disease. So if we take good control of our diabetes right from the time it is diagnosed, then we can prevent a lot of this coronary artery disease in future. We should visit a dietitian, have a proper diet chart. We should be very conscious of the calorie intake, and we should take diabetic medicines regularly. We should follow with our diabetologist or physician and get the medicine adjusted from time to time. Here again, we should have a glucometer at home. We should check our blood glucose levels frequently, so that if the levels are high, we can visit the doctor and get our medicines adjusted. Regarding diabetes also, regular physical activity is important. It helps in controlling the diabetes in a better way. And regarding the investigations for diabetes, we should do HbA1c test, which gives an average blood sugar level for the last 3 months. Every 3 months we should do it. Our target should be that we should maintain the HbA1c below 7%. So if the HbA1c is below 7%, that means our diabetes is fairly under control. Another important risk factor is the use of tobacco. People who smoke or who use tobacco in any other form like jarda or chewing tobacco, then those people are also at high risk of developing coronary artery disease. What we see in young people who come with heart attack, the most important risk factor in this subset of patient is use of tobacco. Most of these young people are smokers. So we should refrain from smoking, and people who are addicted to smoking, nowadays we have other means to quit smoking. There are self-help groups, there are some medicines such as nicotine gums are available. There are some other type of oral tablets also available which can help us quit smoking. So we can consult our doctor and we can be started on these medications or this chewing gums once we have made up our mind to quit smoking. Another important thing which we observe in our society these days is obesity. A lot of people are overweight and they are obese. Obesity also increases our risk of developing coronary artery disease. We should always try to maintain our weight in the ideal range. That is, we should keep our BMI below 23 kg per square meter body surface area. So to maintain our weight, again following a proper diet is important. We should avoid junk foods or high calorie foods, and we should always go for a regular physical activity. Then if we are overweight, then we can consult a dietitian and then follow a weight reducing diet. Another important aspect which we see these days is physical inactivity. Most of the children, most of the adults, they are addicted to gadgets, and we see hardly any form of physical activity in the form of sports even among children. So we should change this trend. We should encourage our children or our brothers and sisters to go for regular form of some physical activity. They can be involved in any sports. They can go to the gym, do cardio in the gym, or they can go for swimming if they are interested. They can do some form of dance, or even bicycling, or even brisk walking is good enough. So regular physical activity, at least 30 minutes for at least 5 days in a week, is essential to prevent coronary artery disease. Apart from this, what we see these days is there's a lot of stress also. Either it could be a work related stress. We live in a society where a lot of targets have to be met. This puts individuals at a lot of stress. So we should devise some means to overcome this stress. Stress is also an important risk factor which can lead to coronary artery disease. And apart from this, there are other risk factors such as genetic risk factors. If our parents or brothers and sisters have coronary artery disease, we also have a high risk of developing coronary artery disease. These are called the fixed risk factors. Another fixed risk factor is age. As we age, our risk increases. Another fixed risk factor is gender. If you belong to the male gender, you are at a higher risk. These fixed risk factors cannot be changed. If I am a male, I cannot change my gender. If I am aging, I cannot decrease my age. If I inherit some genes from my parents, I cannot change those genes. So these are non-modifiable risk factors. So this we cannot change. So our focus should be on the other risk factors which I have told earlier, which are modifiable risk factors. Most important among these are hypertension or blood pressure, raised blood pressure, diabetes, obesity, physical inactivity, smoking, and stress, lot of mental stress, which can also lead to coronary artery disease. If we are able to control all these risk factors, we can decrease the burden of coronary artery disease significantly in the population, and we can reduce the burden on our healthcare system and also the cost which comes with treating coronary artery disease. With this, I will wind up my talk. Thank you.